Hello. Hello, everybody. I'm Dr. Meghna Shekhawat. I'm an Ayurvedic doctor by profession and also a naturopathist. So, in this Corona time, we are already struggling with this pandemic, coronavirus, but there are also other diseases from which we are struggling from for many years. So, I'm here with the topic thyroid disorders. um, Everybody and everyone in the family literally says when they want to say that we are committed or we are trusted, I swear, right? So this is the thyroid gland where you take the swear. It is right in the front of the neck, you can see. And if I talk about the anatomy, it is brownish red in color, it is U-shaped, it is butterfly shape. You can see this thyroid gland is like this. And it is an endocrine gland, like ductless gland it is, and it weighs only 15 to 20 grams. And it is just in the front of the neck. You can even see the swelling in the patient who is suffering from hypothyroidism or hyperthyroidism. Why this thyroid is very important for us? Because it helps to increase our BMR. BMR like basal metabolic rate. Uh, Actually, everything depends on our metabolism. Whatever we are doing, whatever we are eating, everything converts into energy. Like whatever food we are taking, and our if our metabolism very slow, right? If it's very slow, then what happens? Proper growth will not occur, and definitely it causes so many diseases. And thyroid plays a very important role in our metabolism. It helps in the growth. Definitely it helps in the entire personality growth. It helps to check the heart rate, causing the cardiac output, nervous system, and reproductive system. So many system this thyroid hormone is tackling, right? Only 10 to 20 grams thyroid gland is situated in our neck is handling so many systems. So yes, this thyroid is very, very important. Now we are talking about the two main important diseases or disorders that are caused due to the impairment of the thyroid gland, that are hypothyroidism and hyperthyroidism. And let me tell you very frankly, this is the second most prevalent disease in India after diabetes. 11% of Indians are suffering from thyroidism. And if we check out the ratio of male and female, then definitely females are more prone for hypo or hyperthyroidism, and the ratio lies about 6 to 1. Now you can see here there are hypothalamus. This is in the brain part. Hypothalamus is there. Then the pituitary gland. It is in the pineal part, and the thyroid gland. These three are interconnected to each other. What hypothalamus actually does? It produces thyroid releasing hormone, and then pituitary is secreting the thyroid stimulating hormone, and finally hypothalamus gives order to pituitary, and then pituitary gives order or release the hormone for thyroid, and then thyroid secretes T3 and T4. And this is the proper channel, right? If everything happens frequently, like if everything is in order, then definitely we are in the euthyroid phase, means everything is in normal. But when there is a negative feedback, if there is any disturbance in the channel, then there are thyroid disorder, that is hypo and hyper. About the hypothyroidism, what happens when thyroid is very underactive, means there is a low production of T3 and T4 that I told already. T3 and T4 hormones produced by the thyroid gland that are produced in very low quantity, then hypothyroidism happens. And if they are produced in high quantity, then it is hyperthyroidism. Like you can see when TSH is low, means the pituitary that is producing the hormone TSH, if it is low, then it is hyperthyroidism when T3 and T4 are high. And if T3 and T4 are low, high, and TSH is low, then it is hypothyroidism. So this is a very simple concept, and you can see hypothyroidism, it is underactive thyroid, and in hyperthyroidism it is overactive thyroid. It can be caused by iodine deficiency also. You can see if we are taking low iodine in our diet, then definitely because of the iodine deficiency, hypothyroidism can occur, Graves' disease can occur, and hyperthyroidism is also caused by inflammation of the thyroid gland. And it is Vat Kafach Prakriti. If I talk about the Ayurveda, then it is Vat Kafach Prakriti. Vat, Pitta, Kaf are the three basic fundas of Ayurveda, and hypothyroidism is basically caused by the Vat Kafach Vikar, and hyperthyroidism is caused by Vat Pitta Vikar. Now you can see and analyze the factor. If patients are coming to us and they say we are having the hair loss is a common factor. Inability to think, बार बार भूल जाते हैं या कि आजकल कुछ याद नहीं रहता. Swelling in the neck, it is a common factor. Reduced heart rate, यानी कि उनको ऐसा लगता है कि बहुत अच्छे से काम नहीं कर पा रहे, एक्सरसाइज करते हैं, सीढ़ियां चढ़ते हैं, देन हाफने लग जाते हैं. तो इट इज रिड्यूस हार्ट रेट एंड स्ट्रॉन्ग फैटिक. दे गेट टायर्ड वेरी इजीली. सेंसिटिविटी टू कोल्ड, बहुत ज्यादा ठंड लगती है. ड्राई स्किन अगर उनको महसूस हो रही है, दैट वेदर चेंजेस एंड देयर इज अ ड्राई स्किन, और रेगुलरली इट इज अ ड्राई स्किन, और अ सडन वेट गेन, अचानक से उनका वेट बढ़ने लगता है. पफिनेस ऑन द फेस, जब सुबह सो के उठते हैं, देन देयर इज अ पफिनेस ऑन द फेस. And menstrual problems, if she is a lady, then definitely menstrual disorders are there. Infertility can be there, and severe PMS, यानी कि पेट में दर्द हो सकता है उनको. Mood swings and joint muscle cramps are there. High cholesterol level in the hypothyroidism. Of course, if we check the cholesterol level, if we are going for the regular checkup in 6 months, then definitely it can be the cause of hypothyroidism. What about the hyperthyroidism? If a patient, she's very weak, but she says I'm eating a lot, but nothing on my body. कुछ भी नहीं लगता, हम खाते इतना है, but body बिल्कुल वैसे के वैसे है. And there is also, of course, hair loss है, bulging of eyes are there. Exophthalmos condition means उसमें eyes बिल्कुल बाहर की तरफ आ जाती है. Swelling in the neck is the common factor. Heart palpitation, धक 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 धक, जैसे normally बताते patients. It's a feeling there. Tremors होते हैं उनको. गर्मी सहन नहीं होती. हीट टॉलरेंस, इंटॉलरेंस इज देयर. स्लीप डिस्टर्बेंस आर देयर. नींद नहीं आती है. जबकि हाइपोथायराइडिज्म में इन दैट केस भूख कम लगती है एंड नींद बहुत अच्छी आती है. इनको भूख लगती है बट इट डजंट, यानी कि मेटाबॉलिज्म इज हायर, तो जो भी खा रहे हैं पच बहुत जल्दी रहा है लेकिन बॉडी को लग नहीं रहा है. तो दिस इज अ सिंपल कॉज. इनका एपेटाइट बहुत ज्यादा होता है. ऑफ कोर्स इफ दे आर ईटिंग अ लॉट. इरेगुलर मेंस्ट्रुअल periods are there if she is a girl. Sweating is more. Hypothyroidism there is low sweating, but in hyperthyroidism there is more sweating. उनको anxiety भी ज्यादा रहती है. Depression and mood swings are common in both the cases. So this is a simple case. अगर मेरे पास कोई healthy, अगर मैं आपको directly बताऊं, healthy and कोई weaker person आ रहा है, they are coming with the same condition, then definitely first scenario will be, जो उनके symptoms देखकर होगा, तो definitely a person can be hypo or the second can be the hyper. So what we do first, after the physical examination, we go for the lab test, TFT, thyroid function test, and we regularly do the TSH. If TSH is normal, then it's okay. If there is a abnormality, then definitely we are going for the higher test. What is the normal range? If you go for the lab test, then the TSH is in the normal range of 0.34 to 4.25 international unit per ml, and T4 it is in the range of 5.4 to 11.7 microgram per deciliter, and T3 is in the range of 77 to 135 ng nanogram per deciliter. So these are the normal values. If I say there is a low TSH and higher side T4 and T3, then definitely it is hyperthyroidism. And if TSH is higher side and both T4 and T3 are on the lower side, then definitely it can be the case of primary hypothyroid, or it can be the case of secondary hypothyroid. So according to Ayurveda, if the channel is very functional, very unique in continuation, like the entire channel is hypothyroid to pituitary and then to thyroid, if this is okay, then we are in the euthyroid, means normal case. But if there is a disturbance, in the values TSH, T3, T4, and if it is on the lower side of TSH, then definitely it can be hyper. According to Ayurveda, if it is Vat Kafaj, then it is hypo, means the obese person. It is a Kafaj Prakriti, we already taken it. And if it is very weak, very lighter mood person, then it is hyperthyroidism, that is Pitta, Vat Pitta Prakriti. So you can see what Ayurveda says basically. It is hypothyroidism. It is santarpan, means like when we are eating a lot, matlab heavy, you can keep in that category. And hyperthyroidism, very weak type kind of person. It is Kafaj and Vataj, and it is Pittaj and Vataj. Now I'll move forward. So what happened when a patient comes to the Ayurveda doctor? Already that patient is taking thyroxine, levothyroxine, etroxine, many tablets. They are already on that tablets, but what they have to take this medicines for the lifetime. But now people want, there should be some alteration, and they want to get rid of these medicines, or they want to move for the lower doses. Initially we don't stop the medicines, but we go for the Ayurveda treatment. That is the saman chikitsa at the first, that is the medicinal treatment we are taking care of. The second one is the Shodhan chikitsa, that is the Panchkarma or the purification therapy. The third one is the Ahar Vihar. It's very important in Ayurveda treatment, what Ahar Vihar, or what is our lifestyle. So it matters a lot. About the hypo, just already we discussed, it is Vat Kafaj Prakriti, and hyper is the Vat Pittaj Prakriti. So we give the treatment according to that only. Now the Samshodhan or Panchkarma therapy, what we actually take in the Panchkarma therapy is the Vaman Chikitsa. That is, Vaman is the detoxification of the body from the upper side, because thyroid is situated in the neck, and that is the region of Kapha. So we go for the Vaman Chikitsa. Virejan in the case of hyperthyroidism, that is, Virejan is the detoxification of body from the lower part. And Nasya, direct input of medicine through the nostrils. Shirodhara in case of the mental stress. Already, if a person is hyper category patient, then definitely there is some sort of a mental stress, or mental problems can occur in future. So we give the Shirodhara because it also affects the CNS, central nervous system. Basti is also detoxification of body from the lower part. Now the Samshan Chikitsa, it is the medicinal therapy what we are giving according to the patient. So you can see this is a Panchkarma therapy. The first one is the Vaman, that is from the upper part of the body. This is a Shirodhara, and the third is the Nasya. Now the medicine we are generally giving to the patient is the Kachnar Kukul. It's very good in the thyroid cases. Shagru, it's very rich in iodine. Brahmi Ashwagandha, it's very easily available, and it affects a lot on their entire body constitution. Varunadi Kashai, Purandava, Trifla Gugul, Trikatu, Trivart, Gomutra. Gomutra is also very effective and can be given as an enema also. Arabad, Giloy is very common nowadays. It is also very effective in corona. Sushekar Ras, Chandrakala Ras, Shatavari Churn, Trifla Guglu, Shila Jatu, Vardhaman Pipali. It's a Rasayan, because we need the Rasayan therapy as well in this thyroidism. Abrakbas, Trivangbas, these are some parts of the medicine, but we cannot give it directly. We give this medicine according to the condition of the patient. Even we can't suggest it directly, because there are a lot of factors according to Ayurveda. We have to discuss a lot. What is the actual Prakriti? What is the other conditions you are facing nowadays? So there are a lot of factors we have to talk. And because Vata and Pitta, both are different, entirely different Prakriti. So we have to divide this medicine accordingly. Like in the Kafaj Prakriti, we have to increase the digestive fire, and in the Pitta Prakriti, we have to lower the digestive fire, or we have to lower the metabolism. So we have to see the condition of the patients, then only we can suggest now the thyroid diet foods, because diet affects a lot. Of course, the lifestyle modification, what you eat, what, how you spend your day. So it's very important. So that is very important part. So you can see what you can take in the hypothyroidism. One thing is the goitrogens. Goitrogens are like soya foods, cabbage, broccoli, sprouts, you can say cauliflower. All these are the goitrogens. Means when they are taken in the diet, then they lowers the absorption of thyroid hormones in the body. So we have to avoid, if we are facing the thyroid disorders, so definitely we have to avoid the goitrogens. So you can see there are a lot of things we can take, green leafy vegetables. So you can make a complete list with this. You have to take the iron, selenium rich food, and iodine rich food, vitamin D, calcium. So it's very useful for your diet. And one thing you have to ignore, the caffeine rich food or drinks, because it also lowers the absorption of thyroid. And even if you're taking, then even if you're on medicine, then avoid taking medicine after you take any food or drinks, at least for 1 hour. So it will be very effective. Now you can also see do's and don'ts. In case of the hyperthyroidism, you can take the antioxidant rich foods, calcium rich foods, magnesium rich food, selenium rich food, but we have to avoid in hyperthyroidism case iodine rich food. जबकि आपको लेना था hypothyroidism में, you have to take iodine rich food, but in hyperthyroidism case you have to avoid iodine rich food, because already metabolism is there और हार्मोन का लेवल बढ़ा हुआ है, तो हमें ये फूड्स को अवॉइड करना है. कैफीन to be avoided in both the cases. Trans fat and sugars, high sugars are to be avoided in both the cases. You can take the vitamin D rich food, magnesium rich food, selenium rich food, and anti-inflammatory herbs and spices we already said. So you can start taking spices in larger quantity, like haldi is very common, turmeric that you can take, marriage or black pepper you can easily take. Now yoga for the thyroidism, yoga plays a very big role in thyroid disorders. One very common is the ujjayi pranayam. You can inhale, or you can fill vayu in your lungs and then hold it for some time, and just keep a sound, or and this is the Ujjayi pranayam. So it is very effective in thyroid disorder. And one is the kanthanad of the soham, because this gland is the like a sound of hum is very important here. If you take the soham, if you regularly keep doing this, then definitely it works a lot, because hum is the main जिसे कह सकते हैं यहाँ का thyroid gland का main अक्षर है, and soham is very important for thyroid disorders. Other yoga therapies you can inculcate, like halasan, matyasan, sarvangasan, and surya namaskar. These are very useful for the thyroid. And one thing you have to take care of, जैसे मैंने पहले भी बताया, hypothyroidism is a case of the kapha disorder, so you have to take the pranayam or yoga which are hot in nature. And in case of hyperthyroidism, which is already very पित्त, already बहुत अग्नि है वहां पे, तो वहां पे हमें ठंडे प्राणायाम और योगा आसन करने होंगे. Like the शीतली will work in the hyperthyroidism case, and ujjayi will work on the hypothyroidism. Kapalbhati also works in the hypothyroidism case. So we have to take care of a lot of things when we design our lifestyle, when we design our yoga sessions, when we design our medicinal therapies. Of course, it plays a very important role. Thyroid disorders are not completely lifestyle disorders, but they are partially lifestyle disorders. So we have to take care of the lifestyle modification as well. So because we have time of 20 minutes only, so I have completed my session here. And if there is any question, you can directly ask me. If there is any question, you can directly ask me the questions. And one more thing that every patient asks us generally, can we get out of this thyroid disorder or disease? Definitely, if you are following all these, you are taking the proper medication, if you are taking care of your lifestyle, if you are taking care of all the Shodhan therapies, then definitely you can recover. Ahar Vihar plays a very important role. Pathya is very important. So this plays a very important role in. So you can directly go for it. I can see a question. Water. The pros of Ayurveda in general. Actually, Ayurveda is based on the principle Swasthasya Swasthya Rakshanam Aturasya Vikar Prashmanam Jab. Means to maintain the health of a healthy person and to help unhealthy person to keep to maintain their health. मीन्स जो स्वस्थ व्यक्ति है उसके स्वास्थ्य की रक्षा करना और जो अस्वस्थ है और कोई भी रोग है उसे तो उसको हेल्प आउट करना कि वो उस चीज से उभर आए. सो दिस इज द बेसिक like principle of Ayurveda, and we all work on that. And also we work on the Prakriti. Means the Panch Mahabhut. It's everything in the world is made of Panch Mahabhut, and the dosha, three doshas, Vata, Pitta, Kapha, are also like constitution of this Panch Mahabhut. So every Prakriti means everyone on this world is having some constitution of this Panchamahabhut factors. Like somebody can be the Vatik Prakriti, someone can be the Pathic Prakriti, and someone is a Kafach Prakriti. If I classify the three person, like one is very weak, like very weaker side, and one is the medium phase, and the third one is of heavier side. So that person who is on the very lower side, that is underweight, that is of a Vatach Prakriti, medium one is of the Pittach Prakriti, and Kafach Prakriti, that obese or overweight person. So you can classify these in general, that if there is a single Prakriti, and that every person can be the combination of two prakritis like Vat Pittaj, Pittaj Kafaj, or Vat Kafaj, or like all the three prakritis in general. So every disease depends on what prakriti, or like if I take the acidity, Pittaj prakriti patient mostly have the acidity because Agni unme already badi hui hai, and the Pitta is the main constitution of the Agni Panchamahabhut. So it can be the Pathic Prakriti. So is there any other question? And if you want to talk me in person, if you want a private session, then definitely you can use this link. You can click it and directly book an appointment with me. I'm expert in lifestyle disorders, gynec problems, internal problem. Corona times we are handling it like anything. So in general, also you can talk to me. Wellness centers we are running, Panchkarma therapies, the jog therapy, leech therapy, Agni Karma. We are handling all this. So Ayurveda is entirely a combination of many things. Panchkarma is a very beautiful part of it because it is entirely detoxification part, detoxification therapies we do there. Leech therapy, it is the like Rakta Mokshan. We uses leech for the skin diseases or any Agni or Pittaj Vikar, Rakta Vikar. And Agni Karma, any type of stool, any type of pain, it gives a very wonderful result in the pain management. So we can go for Agni Karma for the pain management. Other than that, there are yoga therapies also. There are Sanchaman and Chikitsa also, like the medicinal therapy gives wonderful results in any kind of diseases. And Ayurveda basically works on the roots. It don't give you instant medicine and the instant relief, but it also works on the roots. Like if you have a migraine, then what is the reason of migraine? If you have a thyroid, what is the reason of the thyroid, and what prakriti you have? So it entirely works on the principles, and it entirely works on the roots. You can talk to me in personal also. My number is there. My email ID is there. You can directly click on this link shared by Thrive. And I also like to thank Thrive for giving me this platform so I can interact with a number of patients and I can solve their problems. So you can directly talk to me via Thrive and this link shared. And Ayurveda helps every person who is in need. So I am always there. If you want, definitely I'm there. You can talk me directly. Thank you everybody for your patient listening. See you, and I can go forward and I'm always ready to help anyone who is seeking for a good health. Thank you so much.